it going? Okay. Hi, my name is Carla. I'm one of the student nurses taking care of you today. Nicole, is it okay if I do a comprehensive head-to-toe assessment on you?
Yes, please.
Okay, perfect. I'm going to go ahead and wash my hands first. Just keep this open. Okay. All right. I'm going to go ahead by inspecting your head and your scalp and your upper and lower extremities first and your skin.
Sure.
I notice no cyanosis to your lips. There's no areas of acne noted. Your skin's intact. There's no open sores or bruising or redness noted. On your arms, again, no cyanosis to your fingertips. There's no areas of redness, abnormal moles, bruising, rashes. Your lower extremities are, again, warm with good skin color. No areas of ecchymosis or rashes noted. No cyanosis noted to your toes as well. Your hair, it's great in color. There's a little red dryness noted, but given the type of weather that we're having now, which is totally understandable, there's even distribution throughout. There's no areas of alopecia that I would be concerned about, or patches that I would be concerned about. I'm going to continue on with my exam and go to our head and neck. We're just going to start by inspecting your neck, which I see that there's no discoloration, there's no edema, there's no marks, there's no bruising, there's no ecchymosis to it, there's no large bulges or masses. I'm going to go ahead and continue on and inspect and listen to your bilateral temporal arteries as well. Thank you. Okay. Expected intensity noted, +2 to your left. And inspected intensity noted to your right. I'm going to go ahead and listen. Okay. No bruit noted to your left temporal artery, and no bruit noted to your right temporal artery. Great. I'm going to go ahead and continue on by palpating your frontal and maxillary sinuses. Let me know if you feel any tenderness or pain at all. No. And I'm going to go ahead and move on to your TMJ. We're just going to have you open your mouth for me and close. Is there any pain with opening and closing your mouth?
No.
There was no signs of crepitus or popping or rubbing with the opening and closing of your mouth. I'm going to go ahead and continue on and assess your lymph nodes of your head, of your neck, of your neck, and of your clavicle as well, and into your axilla bilaterally. I feel no enlargement throughout. Do you feel any tenderness while I was palpating? Okay. I'm going to go ahead and inspect and feel for your thyroid. So I'm just going to have you do, sorry that my hands are cold, I'm going to have you give me a swallow. Good. I could feel your thyroid on palpation, but again, just assessing your neck with your trachea being midline. I see no large bulging from your thyroid or anything like that, which is great. I'm going to head and conclude our head and neck exam by listening and feeling your carotid arteries. And again, of inspected intensity of +2. And again, of inspected intensity of +2. I'm going to head and listen. Okay. No bruit noted. And again, no bruit noted. Wonderful. Okay, so I'm going to go ahead and we're going to move on to our eye exam. And just by assessing you right now, I'm observing your sclera, which is white. Your conjunctiva is pink and moist. I see no drainage. I see no areas of redness. I'm going to go ahead and palpate your upper and lower eyelids. Is there any pain with palpation there at all?
Nope.
No? Wonderful. I'm going to go ahead and I'm going to test your vision doing a certain number of tests. First, I'm going to start with your extraocular movements. I'm just going to have you follow my finger while not moving your head. As I do too. There we go. Good. In. Good. Oh, my computer went black. No extra ocular movement. Is it still going? Yes. No extra ocular movements noted, and your convergence is within normal limits. I'm now going to go ahead and check your pupillary reflex by shining a light into your eye. I want you to go ahead and just stare straight ahead. Good. And again. Good. Your eyes are pearl. 3 millimeter burst reaction to the light. I'm going to go ahead and check your peripheral vision. So I'm just going to have you tell me when you can see my fingers.
Yep.
Good. And again.
Yep.
Good. Peripheral vision is intact. I'm going to go ahead and use a ophthalmoscope to take a peek into your eyes. Okay. All right. I'm just going to get nice and close to you. I'm so sorry. I'm just going to go ahead and look. Good. Sharp disc of margin noted. no hemorrhage noted, and red light reflex is intact. I'm going to go ahead and I would perform a Snellen chart exam on you right now. For no purposes, since I don't have one, I would explain how I'm going to do that. And I'm going to have you stand 20 feet away from an eye chart, covering one eye, your other eye, and then using both eyes to see the chart at 20 feet. Whatever line you could get to, I would have, that would be your vision of what you could see from 40 feet away, actually at 20 feet. So it could be 20/20, 20/30, 20/40, and so forth. To continue on with exams, I'm going to go ahead and inspect your ears. So I'm just looking at your ears now. They're symmetrical. They're properly placed on your head. There's no sign of drainage or redness noted. I'm going to go ahead and I'm going to take my otoscope and go ahead and take a peek at your ears. I'm going to pull back and view. Good. Canals are pink and your TM is pearly gray. There's no obstruction or occlusion. And again here, sorry for my backside to the computer. Your canals are pink and your TMs are nice and pearly gray. Great. There's no pain. Oh, good. I went back again. There's no pain at all when I'm touching. I'm now going to continue on. We're going to perform. Let's go back. Okay, there we go. I'm now going to perform 3 types of hearing tests. The first is going to be a whisper exam where I'm going to whisper word into your ear, and I'm going to have you occlude your other ear and then repeat back to me. Okay?
Apple, dog, bird.
Perfect. And we're going to do the other ear.
Cat, 7, door.
Perfect. And we're going to move on to our Weber exam, which I'm going to have you listen. I'm going to take this tuning fork and I'm going to place it in the center of your head. And I want you to tell me if the noise is equal bilaterally or if your hearing feels different in one ear, okay?
Is equal.
Okay, wonderful. And we're going to continue on with doing the the Rene test, which I'm going to test your air conduction versus your bone conduction. I'm going to go ahead and use this tuning fork again and place it behind your ear.
Mm-hmm.
You're going to tell me when you no longer hear the noise, and I'm going to be timing it, and then I'm going to place it to the outside of your ear, and again, time it.
Okay.
Your air conduction should be greater than your bone conduction, okay? Okay, air conduction was greater on your left side. And again, we're going to do it to your left side. And again, your air conduction is greater than your bone conduction. So moving on from your ears, we're going to assess your nose. I'm looking at your nose now, just talking to you, and there's no obvious deformities to discoloration. There's no redness, no drainage noted. I'm going to use my otoscope and I'm going to peer into your nares just to make sure that there's no discoloration or drainage. Okay, good. Your nares are clear. There's pink in color. There's no drainage or obstruction noted, no blood noted. I'm going to progress forward and I'm going to assess your mouth. And by using your mouth, I'm noticing that your lips are not cyanotic. I'm going to have you open your mouth. They're pink. They're moist. Go ahead and look into your mouth by using my light as well. I was about to put that in your mouth. Good. Your uvula is intact. I can see your tonsils. Just going to have lift your tongue down. Good. Lift it up to the side and to the side again. Great. I see no areas of sores or lesions. Your teeth are intact. There's no obvious chips or cracks that I can see. There's no bleeding from your gums. So that includes our head, ears, eyes, nose, and throat exam. So I'm going to go ahead and I'm going to continue on with our cardiac exam. And what I'm going to have you do first with your cardiac exam is that I'm going to assess for any jugular vein distension, your JVD. Optimal position would be to have you at 30, 45, and 90 degrees, but for the sake of learning, we're just going to do in this position. So I'm just going to have you turn your head slightly, which I see no obvious dissension, no obvious pulsations. And again, here, no obvious dissension or pulsations. I would expect JVD with someone who has any type of heart failure or any type of cardiac abnormality. Now I'm going to continue on and I'm going to check your pulses. And so I'm going to have you come on over here, and we're going to inspect your PMI and your heart, your pulse of maximal impulse. And the best position that I can do that in is having in your left lateral side. Okay. Left lateral side, and it's in your left fifth intercostal space down. So 1, sorry that my butt is right here, 2, 3, 4, and 5. So I'm just gonna feel. And good. Okay, I'm gonna have you take a seat up, and I'm gonna continue on with checking your pulses. Okay. Great. And I'm just gonna check your carotid pulses. Good. And your brachial. Wonderful. Your radial. And your popliteal. Your dorsal pedis pulse on top of your foot. And your posterior tibial. All so far are +2 with normal intensity. You're going to feel for your carotid again. Your brachial. Your radial. Sorry, my hands are a little cold. Popliteal. Your DP. And your posterior tibial as well. All within +2 normal intensity. They're equal on both sides. I'm now going to go ahead and I'm going to auscultate your heart sounds in 5 different spots using both sides of my stethoscope, using the bell and diaphragm. I'm going to be listening for your S1, S2. Oh no, I'm back again. S1, S2. Oop. Sorry about that. Just wanted to make sure. S1, S2 cardiac sounds. Okay. When I do this, I'm going to have you just breathe normally, and then I'm going to have you also say 99 when we're going through them as well. Okay. So the first part that I'm going to look at will be your right second intercostal space, which is your aortic valve, which I'm going to take a listen. Good. The second spot is your second left intercostal space on your left side, which is your pulmonic valve. Your third intercostal space, which is your Erb's point, left-sided. Your fourth intercostal space on the left side, which is your tricuspid valve. And the fifth place is the fifth intercostal space on the left side, midclavicular, is your mitral valve. And then we're going to go through it again. Aortic, pulmonic, Erb's, tricuspid, and to include on the fifth lateral, the fifth left side, the fifth intercostal left side of your heart is your mitral valve. Great. I heard all S1, S2 sounds normally. There was no additional cardiac sounds or heart murmurs noted. I'm going to go ahead and I'm just going to check your capillary refill onto your fingers. And again, that's less than 3. And less than 3, good cap refill. Less than 3 on your toes. And again, less than 3 on both toes. So that concludes our cardiac assessment. So I'm going to go ahead and move on to a respiratory assessment, which first I'm going to assess for phlebitis on your chest and on your interior and posterior side of your chest. Okay. So what I'm going to have you say is that I'm going to have you say 99 as my hands left on your chest.
99.
Good. 99. Wonderful. I'm just going to switch around.
99. 99.
Wonderful. The next thing we're going to have you do is I'm just going to have you breathe nice, good deep breaths. And I'm just going to place my hands on your chest and observe for symmetrical rise and fall of your chest as well. Okay, so go ahead, deep breath. Good. And out. Good, good. Deep breath. And out. Chest is symmetrical. Good, equal rise and fall of the chest. No, good. My computer screen went black, so I'm just going to hit that one more time just to make sure we're still filming. Okay, good. I'm now going to go ahead and listen to your interior and posterior lung sounds, making sure that you're not hear any crackles or wheezes or rhonchi or rails. I'm going to do this twice through. First thing I'm going to have you do is that I'm just going to have you take nice, good, deep breaths. Excuse me, and the second time I'm going to have you say 99. There are 6 sides that I'm going to listen to anteriorly and 10 areas that I'm going to auscultate posteriorly for you, okay? Deep breaths. Good. Breath. Good. Breath. Good. Deep breath. Deep breath. Good. And deep breath. Good. I'm just going to switch around to your back. Deep breath. Good. 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 No abnormal breath sounds heard. Sounds clear and equal throughout. And I'm going to go ahead and have you say 99 every time I move my stethoscope again, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99
Silence that. There we go. Okay. And to conclude our respiratory assessment, I'm going to go ahead and check your pulse oximetry reading. Don't have one right now on me, but for teaching sakes, I would be using a device that can check your fiber optic light, that has a fiber optic light, I should say, and I would put it on any type of your finger, and it would test your percentage of oxygenated hemoglobin on your red blood cells that's circulating through your body. Because you're a healthy young woman, it would probably be greater than 97, but if you had a history of emphysema or COPD or were a smoker, they can expect it to be 93% or somewhere around there. Okay? We're going to move forward with our GI assessments. We're going to have you lay down. I'm just going to tap this one more time, making sure that it's not black. Okay, good. There we go. Okay. For this sake, again, I'm going to have Nicole keep her clothes on. We're not in a Johnny, so I'm not going to expose her stomach. But similar to when I would be listening to her lung sounds and her heart sounds, I would have those areas exposed. But for the sake of the video and the patient's privacy, I'm just going to listen and inspect over her shirt. So to start with the GI, I'm going to be inspecting your abdomen. Again, I would expose your abdomen, but for this sake, I'm going to keep your shirt covered. I'm inspecting her abdomen for any type of bulging, abnormalities, masses, areas of distension, discoloration, bruising, things like that. Which as I'm inspecting, I see that it's all within normal and there are no abnormalities. I'm now going to move forward and I'm going to auscultate for your bowel sounds. I'm going to start in the right lower quadrant and work in a clockwise manner. I hear normal active bowel sounds throughout, which is good. I'm now going to go ahead and percuss your abdomen in a zigzag pattern. Your right upper quadrant is dull due to your spleen. Same thing with your left. But when percussing your right upper quadrant, I am assessing for her spleen, which I can see is within normal size of about 5 to 6 centimeters. And the reason why I can measure this out is due to changing of sounds from dullness to tympany and measuring it that way. I'm now going to progress to palpation, using light palpation. I'm going to use the tip, 3 of my fingertips and go through her abdomen. Great. And you can just let me know if you're in any pain at all. Was there any pain with that? No. And now I'm just gonna, for educational purposes, I'm gonna tell you how I would do deep palpation. I would use 2 hands and push down with more of a pressure through all quadrants. I'm assessing for organs and any type of masses or bulging or anything like that. To assess for your liver, I would put one arm underneath your lower rib cage, and I would push up, raising up your lower back, and using my right hand to push down with a little bit more force and have you take a deep breath to feel for your liver. I would do the same for your left upper quadrant to test for your spleen. And then to do your kidneys, I would then again put it just below where I would measure for your spleen, push down and palpate through on your right side and your left side. So I'm just going to have you sit up for a second. I did realize that during our respiratory assessment, I did not percuss your interior and your posterior chest, so I'm sorry that I'm going out of order, but I'm just going to go ahead and just percuss your chest really fast. Again, 6 areas on the front side of the chest, which I hear all resonant sounds, which is good, and 10 sides on the back. And now that I have you sitting up, I'm continuing on with the GI assessment. I'm going to assess for a CVA tenderness by performing palpation to your lateral sides of your back, assessing for any kidney abnormalities.
Okay.
Well, let me know if you feel any tenderness at all.
Nope, no tenderness.
Great. Okay, perfect. We're going to go ahead and we're going to continue on with musculoskeletal. So I'm just going to have you come back to the chair. I'm going to touch this because this went black. Make sure that we're still recording. Good. Great. Okay. So for musculoskeletal, again, you're not in a Johnny, but if you were, I'd be thoroughly inspecting your joints, such as like your neck, your shoulders, your elbows, your wrists, your fingers, your hips, your spine, your knees, your ankles, and your toes.
Okay.
I see no abnormalities or deformities that would alert me that you have any type of obvious joint issue.
Mm-hmm.
So to continue on, I'm going to be doing our range of motion and testing your strength to various joints. I'm going to first start with your neck.
Okay.
So I'm going to have you bend down, bend back, look to the side, look to the other side, and then your ear to your shoulder, and then again your ear to your shoulder. Your extension, flexion, and lateral movements are all within normal. I'm going to test your strength by having you push down on my side. Great. And again, and push forward, and push back. Wonderful. Your strength is 5 out of 5 to your neck, which is wonderful. We're going to proceed on to your shoulders. So I'm going to have you sit nice and straight. I'm going to have you lift up one arm all the way up and down. Good. And have you go across your body and out. Good. We're going to do the same thing with the other arm. Up and down and across and back. And then I'm just going to have you bring your arms to the back of you. Good. So your flexion, extension, abduction, and adduction are all within normal. I'm going to test your strength of your shoulders by having you push up. Good. It's intact, 5 out of 5. I'm now going to test your elbow range of motion by having you do one arm up, as if you're lifting a bicep curl, and down. Good. And we can do the same thing for the other arm. Good. Up and down. Great. I'm now going to have you perform supination while holding your arm up like you're holding a bowl of soup, and over, pronation, supination, pronation, and again on the other arm, supination, pronation. Great. I'm going to check your strength by having you push up on my arms. Good. And push down. Great. I'm going to check your wrist range of motion now by having you put your arm, show your hand down like you're showing me a big diamond ring. I'm just going to read this one more time. Like you're showing me a big diamond ring. Good. And have you your fingers up to your ceiling. Great. I'm now going to test your strength by having you push down with your fingers. Good. And pull back. I'm also going to check your wrist if you can go inwards. Good. And out. Good. And I'm going to test your hand strength by having you pull me towards you. Good. And push me away. Wonderful. Next thing I'm going to have you do is I'm going to have you stand on up. And what we're going to do now is I'm going to test your spine range of motion, which I'm going to have you bend backwards for me. Good. And come forward and rest and go forward. Good. And back. And I'm going to have you turn to your side. Good. And turn towards the other way. Wonderful. Lean towards your left. Good. And lean towards your right. Wonderful. Now we're going to go ahead and we're going to check your hip range of motion and strength as well. So if you can come on over here with me. Good. I'm going to have you bend your knee up. Good. And bring it back. Wonderful. And again, we're going to do this way. Bring it up and bring it back. Good. I'm going to have you turn around onto your back. Point your toes up for me if you can. Good. Point your toes up and bring one leg forward. Good. And one leg down. And again, one leg up, one leg down. I'm going to bring your left leg out if you can do that. Good. And then I'm going to have you bring it in and across your body. Good. We're going to do the same thing here. Out and then across your body. Good. I'm just going to have you take a seat. And if you can sit up, I'm just going to test your strength by having you lift up against. Good. Good. Your strength of your hips are 5 out of 5, and your range of motion is also intact. I'm going to test your knee strength and range of motion as well, which I'm going to have you do your knees, and I'm going to have you pull your knees to your chest for me. Good. Another one. Good. And I'm going to have you kick out like you're a rocket. Good. I'm going to test your strength by having you push out. Good. Good. Your flexion strength is 5 out of 5 and intact. So I'm going to make sure this is still recording. Great. 5 out of 5 intact. And now I'm going to go ahead and check your ankles, which I want you to lift your foot up. Good, point down, show it out, and then in. Great, and the same thing with the other leg. Good. And now I'm going to have you push down like we're driving a gas pedal. Good, and pull your toes back to your nose. Wonderful, and again, good, and up. Perfect. That concludes our musculoskeletal assessment, and now I'm going to go ahead and we're going to continue on to our neuro exam. So you can go ahead and take a seat. This time I'm going to be checking your deep tendon reflexes from your brachial, your radial, your brachial, your, where did my, over here. Sorry. We're going to be using your tricep, your bicep, your brachial, your patellar, and your bilateral Achilles tendon as well. Brachial. Good. And again on your left side. Good. And again. Tricep. Great. We're going to go ahead and move on to your knees. Good. Good. And we're going to check your Achilles. Which is going to support your feet. Good. And again, supporting your feet. Wonderful. Okay. The deep tendon reflexes are all within normal and expected reflexes are intact. I'm going to go ahead and continue assessing your cranial nerves. We're going to start by assessing cranial nerve 5, which I'm going to have you clench your teeth down for me. Good. And have you move your jaw side to side for me. Good. I'm now going to continue on assessing for cranial nerve 5 by testing your facial sensation with dull, sharp, or soft objects. So I'm going to have you close your eyes. And I'm going to put 3 objects to your face, and you can tell me which one they are. Stop. Dull. Okay. Dull. Dull. Okay. Sharp. Sharp. Okay, I'm just going to do one more time. Soft. Soft. Okay, just wanted to make sure that it might be a little bit confusing, but just to make sure your soft sensation was intact. Great. I'm going to go ahead and have you perform some serial exams.
Okay.
One being rapid hand motion up and down. Good. I'm also going to have you do shin your left heel to, you can stop doing that.
Oh.
Your left heel to your right shin and go down and up. Good. And again, opposite side, down and up. Good. I'm going to have you touch your finger to my finger and then touch your nose. Good. And I'm just going to move. Good. Good. Perfect. Okay. And before I get you up and have you walk, I'm going to test some cranial nerves. I'm going to continue testing cranial nerve 7, where I'm going to have you squeeze your eyes really, really tight. Good, good, and open. Show me a big smile. Show me your pearly whites. Good, and make a frown. Good. I'm also going to test your cranial nerve 9, 10, and 13 by having you stick out your tongue, open your mouth, and say, ah. Perfect. So I'm going to have you stand. We're going to do a series of walking where I'm going to observe your gait, your stance, and to make sure that there's no abnormalities. So I'm just going to have you walk normally. Great. You can come on back, but walk on your heels this time. Good, I know it's a little difficult. And then you can walk back, walking back on your tippy toes. Wonderful. Okay, go ahead and take a seat. Okay. I'm going to go ahead and check your position sense by having you close your eyes. And I'm going to check and you can tell me if I'm touching and raising your pointer finger or your toes. Okay, so go ahead and close your eyes.
Pointer finger on the right. Toe on the right. Middle finger on the left. Toe on the left.
Okay, perfect. I'm also going to go ahead and I'm going to check, I'm going to write a number in your hand. I'm going to have you close your eyes and tell me what letter I'm writing in your hand. C. Okay. B. Good. So that means that something's intact, but I'm going to come back to it. And now I'm going to also put an object into your hand, and you're going to tell me what it is. Okay. Close your eyes. Key. Okay. Great.
Paperclip.
So key and a paperclip, which is correct. So I tested the patient's Gorf against the G. I'm sorry, I'm just going to forget it, but I tested 2 things that I wanted to check as well. So now I'm going to proceed on to finishing up our exam with a couple of questions I'm going to ask you.
Sure.
For alert and being oriented. Can you tell me where we are right now?
Your house.
Can you tell me your name?
Nicole.
Okay, great. And what year it is?
2018.
Perfect. I'm going to have you count back from 100 by 7s.
Okay, 100, 93, 85, 86, 79,
Mhm.
72, 65, 58, 51, 34, 31, 30, 23, 16, 9, 2.
Okay, perfect. You did so great. That was wonderful. I'm now going to give you 4 words to remember. They are going to be house, dog, plate, and door.
Okay.
And I'm going to have you count back from 20.
20, 19, 18, 17, 16, 15, 14, 15, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
And now I'm also going to give you a piece of paper, and I want you to do what it says. Perfect. Okay. You did really great, and I wanted to thank you for giving me this time to do a full head-to-toe exam on you. And that concludes our exam.
Thank you very much,
Thanks so
Nurse Riley.
much.